expressed in this webinar do not necessarily represent the views, policies, and positions of the Substance Abuse and Mental Health Services Administration or the U.S. Department of Health and Human Services. And SAMHSA, the Substance Abuse and Mental Health Services Administration, is the funder of the PTTC network. And here it is here. There are 10 regional domestic centers around the United States. So if you're not in the Southeast region, one of the 8 states that we serve, from North Carolina down to Florida, over to Mississippi and up to Kentucky, if you're not in our region, you do have a PTTC. And if you go to the pttcnetwork.org, you can find your region. But as I said, we are funded by SAMHSA, and we began, the whole program began in 2018. And really the purpose is to improve the implementation and delivery of effective substance abuse prevention interventions. And like we're doing today, provide training and also technical assistance services to the prevention field. And everything that we do is free of charge. And we'd like to welcome all of you here today. If you joined us last week, welcome back. If you're new, welcome. At the end of the webinar, you'll be able to participate in our evaluation, which SAMHSA calls it their GIPRA. I don't know what it stands for. But once you complete the evaluation, you will automatically be sent to an external link, which sends you to the certificate of attendance. This is the little QR code. You can take your cell phone, which I need to put on quiet, and you can put the camera over the QR code. It takes you right there. It's really cool. But when you're leaving the survey, this is where it says you're going to an external link. Don't worry, it's going to the certificate of attendance. It's a PDF that you can customize with your name and save it to your desktop. Sometimes people have problems accessing it, and I get at least 5 emails. That is okay. But do know you'll also get a thank you for attending email later in your inbox, like an hour or 2 after. And the link is also in that as well. So give it some time, see if it comes through before you email. We are going to have, like 8 polls today that we may or may not get to. But in WebEx, the polling is not so user-friendly. It's found over in the right panel where you guys are chatting. And you can go to view and manage your panels if you want to move the polling up. Or we'll give you plenty of warning that it's coming. So they're over there where a lot of you guys are chatting. That's where you'll see your polls. So with that, I'm going to hand it off to our awesome presenters today. You guys enjoy, and I'll talk to you later.
Fantastic. Thank you, Kristen. How is everybody? We're looking forward to this. Kristen, if you wouldn't mind, go ahead and give me the power, if you will. And it is my esteemed pleasure to be here. My name is Carlton Hall. It is really the honor of my company, CHC, to have been able to help lead both the development and the delivery of this training series that we're providing for you. Over 25 years of experience in this field, had the opportunity of working with some of the leading thinkers in our field and helping to bring some of that learning to bear on behalf of communities across the nation. It is my esteemed honor to have 2 colleagues, 2 friends of mine, who are 2 of the premier instructors in our field of prevention, partnering with me today to help deliver this training with and on behalf of the Southeast Prevention Technology Transfer Center. And hold on, here we go. Oops, sorry. Hold on. So I am really grateful to have Tracy Johnson. Tracy Johnson is the founder and managing partner of TTJ Group with more than 29 years of experience. He has worked closely with states, nonprofits, small businesses, universities, communities, and coalitions across the nation in helping them with community organizing, environmental strategies, strategic planning, substance misuse prevention, and cultural competence. Tracy really has really developed an expertise and has a great team that works on building the capacity in urban communities and communities of faith across this nation. It is our pleasure to have him, and I am equally proud and honored to have my great friend Dave Shavel. We've been working together for more than a couple of decades across the nation. Dave has extensive experience in substance misuse prevention throughout the country at the community, state, and federal levels as a community organizer, coalition director, trainer, and technical assistance provider, a researcher, and a state prevention manager. Dave specializes in technical assistance and training in the areas of strategic planning needs, resource and readiness assessments, prevention program planning, implementation and evaluation, and promoting youth involvement and community involvement and state capacity building. Wanted to make sure that you all were able to get a good sense of the fact that the three of us together, we actually have about a century's worth of experience that we want to make available to you throughout. And so we share that only to say, please take advantage of that. The only thing I need to learn is which thing to click so I can advance the slides forward instead of backwards. But throughout this series, right, we started last week by providing prevention fundamentals to you all. This week we are focused on delving a bit deeper into some of the core aspects that preventionists need to truly understand. We're going to speak about assessment and planning and evaluation in deeper levels than we did in week one. We will come back immediately after the new year with the third phase of this training, in which we're going to really speak to the ideas and the concepts and tools and tactics for community organizing and community organization, and how do we build capacity at the organizational level to do the work that we're doing. And then we're going to offer something quite unique, something that we refer to as a master class, which will really provide an opportunity for those who are able to register. The registration will be limited, but those who are able to register to delve even more deeply into how to practically apply the tools, tactics, and strategies that Tracy, Dave, and I will be sharing across this series. And so we're really looking forward to that. Today, we are going to look at community assessment. We're going to describe those elements. We're looking at the processes and tools for developing tools such as logic models and strategic plans. We're going to delve deeper into evaluation and what does that mean at the community level, and look for ways in which we might be able to apply all this in your practical work, regardless of where you are. That's our hope. Throughout the day, I'm going to be asking you to engage with us in the chat, right? That's how we're going to be able to help make this as rich a training experience as possible for you. And so Kristen and I believe one of our leaders, Dr. Mark Wolfson, is with us today, and will be able to engage with you throughout the chat, speaking to you about your ideas. So go ahead right now and go ahead and put your name and your community and what organization you may happen to represent. We will be engaging with you throughout this training. So I'm going to dive right into the content. Here's the notion. We're going to want you to work with us throughout this training. We only have 90 minutes for this session, and a lot of content to be able to get to. And so please try to bear with us as we kind of work through this content. If you have questions, please place them in the chat regardless of when that question pops up. We will be sure to gather that, and we're going to have a time at the latter end of our training session to be able to have that kind of a conversation around your questions. So I want to start off with a little bit of a review of what we went over during week one, where we really talked about the foundations of prevention. And for me, prevention really is about three things, right? I'm a preventionist. Dave and Tracy, I think, would also describe themselves as preventionists. And as preventionists, I believe we believe in three things, right? We believe that the best way to solve any issue or any problem is to prevent it before it starts, right? That's a core value, core belief that we have. The second thing we believe is in the full engagement and empowerment of the community to participate in the solving of that problem. And then the third thing we believe is being guided by science in order to produce population level change, right? And I don't believe that there's anyone that is on this conference or on this training that would disagree with any of those three core concepts that I spoke to. But how do you actually implement that? Those are three ideas, but how do you implement that? And that's implemented through the use and the application of these core tools that we spoke to during our first training. And for those of you who would have been with us, and even those who were not, what I'd like you to do right now, you see different ideas that are presented here on the screen. You see the epidemiological triangle and the portion and its relationship to the public health model. You see risk factors and protective factors kind of being spoken to. You see the strategic prevention framework and the continuum of care, and an icon that's really representative of looking and thinking about comprehensive strategies. Put in the chat, what is one big idea related to any of these? Just put one big idea associated with any of these in the chat, and I'm really interested in what it is that you are thinking about when you see and think about these key points, okay? So go ahead and put that in the chat, and we're going to check in on that in just a bit. As you're doing that, I want to start off by having and presenting a couple of these key ideas, right? So the epidemiological triangle and its relationship to the public health approach really sets up kind of how we think about the ways in which we do our work. We understand in prevention science that there are really three elements, right, to a population level substance misuse problem, right? Those three elements are you have the agent, you have the host, and you have the environment. The agent is really representative of the issue or the substance itself. So cocaine is an agent, marijuana is an agent, alcohol is an agent, right? But the agent in and of itself does not present a problem unless it then interacts with the host, right? Those are us as individuals who then ingest that agent or participate in developing a behavioral pattern with that agent that becomes problematic. But when I have an agent and a host that come together, I have a problem, but that problem's at the individual level. It is not a problem at the community level until environmental conditions come into play with respect to that. So those environmental conditions are those areas and those conditions that serve to bring the agent and the host together, which is one of the reasons why whenever we're going to try to address these issues, we have those tactics and tools that address the agent. For example, law enforcement addresses the agent, right? We have those that focus on the host. Treatment facilities address and provide support for the host. But preventionists and coalitions are the ones that look at all three and particularly look at the importance of affecting the environment and environment conditions. Why? Because it's at the environment conditions, it's those environmental strategies that will enable us to achieve population level change by implementing policy-based strategies that will help us to be able to do so. So The reason why you cannot smoke in any kind of a federal building or a governmental building or any building where it's a public use of that facility is because that policy base affects the entirety of the environment, affecting agent, host within the context of the environment. The second element that we discussed last time is this idea of the continuum of care. And the continuum of care really was established by what some of us might remember as the Institute of Medicine, now referred to as the National Academies of Science or the National Academies of Medicine. But what they did is they really helped provide a frame for us to help us to think about the relationship that prevention has with the other needs that are going on in terms of addressing the addiction challenges and problems within our society. And so here we see that prevention, whether it's universal prevention strategies as a category, and those are those strategies that affect the entirety of our population, or selective strategies, which are those strategies that are really geared towards or focused towards those that are showing at higher risk for presenting the problem or the issue of substance misuse that we're trying to address, or those indicated strategies that are really geared towards those that have presented that they are participating somewhat with the problem behavior, but have not yet developed that problem to the degree where there is a diagnosis of any kind of an addiction issue or problems before that point. Well, those three categories of prevention strategies are really relevant towards addressing the needs in our society, but they are also in relationship to the further continuum. And so the big point that's made here is that for a community to really develop an effective approach towards addressing addiction problems in their society, they need to have a relationship or involvement with all of these categories and all the relationships from promotion through recovery all the way through the continuum. So we have a responsibility to understand the other aspects of this continuum, even though we refer to ourselves as preventionists. Which brings us to understanding risk and protective factors. And with respect to risk and protection, the big idea here is that those conditions that serve to push us and promote higher risk for involvement and engagement in the problem behavior, we need to address, but we also at the same time need to address and build the protection in our communities, which are those conditions that are found within our society that buffer someone's exposure to involving and getting involved and engaged in the problem behavior. So it's really that balance of risk and protection that as preventionists we are trying to promote. I would love it if you would be able to put in the chat what are the priority risks that you're addressing in your community, and what are the priority protective factors that you may be addressing. Go ahead and put that in the chat, and we're going to have a little bit of a conversation about that throughout. Which brings me now to a set of comprehensive strategies, and the big idea here is that if we're going to affect change, we have to use a set of comprehensive strategies, and that set of comprehensive strategies serve in two elements. One's at the individual level, right? And so we might have strategies that affect the family environment or within the school context or within our individual relationships. Those are individualized strategies. We need them, but we also need to look at the social norms that are going on in our society, address regulations and rules and policies, look at the availability of the substance. Those are referred to as environmental strategies. We have to focus on both. It's not either or, it's both and. And when we do that, we are creating the dosage that's really required in order to produce the kind of change that will affect the population level. Whew. I'm getting through this quickly because there's a lot of content that we need to get to, and where I want to end is the fact that all of those concepts that I just shared with you, what a community does with that concept with those concepts is that they infuse that with a strategy that we refer to as the strategic prevention framework. And this strategic prevention framework allows us to organize the ways in which we work with each other in order to produce change. The 5 key elements of the SPF are assessment, capacity, planning, implementation, and evaluation. Those 5 key elements are then guided by 2 overarching principles of making sure that we are culturally proficient as we're doing that, and we're thinking about sustainability from the start. And as we do both of those things, and we're implementing this, this will allow us to use this planning tool to be able to effectuate change at the population level. I'm going to end by asking us to think about one poll just to give us a bit of an idea about how we're working with this. And forgive this drive-by that I just kind of did with you all. I wanted to be able to set Dave and Tracy up so that they can have time to delve even more deeply. But Kristen, if you wouldn't mind, go ahead and put up poll number 1. And I want you to think about what is the role of coalitions and prevention providers? Is it A, implement this SPF in your communities? B, provide information and education for youth and adults about making healthy decisions? C, addressing risk and protective factors in the community? D, implementing strategies that address the individual and community environments? E, building community resources along that continuum of care? Or something else that you might want to go ahead and place in the chat? Go ahead, and we're going to just provide a few seconds to be able to do this. Few seconds more.
Don't forget that poll is going to be over in the right-hand side where your chat is.
And Kristen, you can go ahead and close out the poll. Let's see what we have here and see where people are. Oh, okay, well, a little bit all over the place. I say a good many of you all thought about something else or provide no answer. So we're going to delve more deeply into this. It's spread out all over the place, Dave. What I'm going to do is turn this over to my great friend Dave Shavel, who is going to take us into digging a little deeper and thinking about assessment. Go ahead, Dave.
Control here, I'll say good morning to everybody. This is Dave Shavel calling in from Portland, Oregon, and thank you for allowing me to work with you all in the southeastern United States. And thank you for letting me work with this wonderful team. And I noticed there was a poll, one of the last chats that I saw pass through here was all of those apply really. We only let you pick one, but those are all the things that we do in prevention. And that's the role of a coalition of us prevention provider to do all those things in the community. And that's what we're going to be spending the rest of today talking about. What is that process of this thing that we've called the strategic prevention framework? And just to start with one little thing to set this up is if you remember the movie Amadeus back in, anybody remember, you can put what year it was in the chat box. Anybody remember? It won 8 Academy Awards and Best Picture. And the movie was about Mozart, the conductor, and he was presenting one of his symphonies to the Emperor of Austria. And he played the symphony to the Emperor, and he asked the Emperor, what'd you think of it? And the Emperor thought, and he said, well, I'd like it, but there are just too many notes. And Mozart's response was, well, which notes do you think I should leave out? And so the point is that, again, there's a lot of good information that we want to provide. As Carlton said, we're going to be spending the rest of this time walking through the strategic prevention framework, and we're going to cover it, at the 10,000 foot level. We're not going down to tell you how to do a needs assessment, how to do a focus group. That's at the ground level. What we want to do, in getting back to Mozart, is as we go through this, we couldn't leave anything out. It's all important. And as we go through this, think about a lot of it, will confirm what you do know. Also make note of what you want more information about. We can provide additional support, and you can look for those areas where you want more information, where you want more detail. And so that's the frame that we'd like you to look at this next piece. And for the information, it won the Best Academy Award in 1985. So I didn't see that. And and we want to frame this assessment. We're going to start walking through the strategic prevention framework. We're going to start with assessment. And the first part is to start with the thought, nothing about us without us. And as Carlton mentioned, this cultural competence is in the middle of the SPF. And so if we're starting with doing an assessment, we want to quote Stephen Covey, we want to seek first to understand before we seek to be understood. So we want to first understand what is that environment? Where do the agent, the host, and the environment come together? We need to understand that. And so if we think about it with cultural competence in mind, here's our first opportunity to, as part of the assessment, to identify what are all the diverse populations, what are all the areas in the community that we need to interact with. Let's start reaching out to them. Let's start engaging them and identifying what are their priorities, what are their needs, what are their strengths, what are their resources, because then we can engage them appropriately in the planning and implementation. So again, we start with building cultural competence early on in the assessment. And so if you think about those of you that attended or have heard this story, thinking back to what we covered in the first session last week, is the river story. And to make a long story short, it's about a town that's along a river, and they notice there are some children being swept downstream. And so they take a lot of efforts to save the children, and they feel good about that. But then they say, hey, we need to walk upstream to find out why the children are falling into the river in the first place, and why don't they have the skills to swim in the river. And so when we talk about doing prevention, we talk about walking upstream and finding out, again, why, what are the conditions that are allowing young people to fall into the river. And so when we talk about doing an assessment, we're looking at that whole river. We want to be able to say, okay, what is the problem? How many youth are falling into the river? How many are being swept downstream? How severe is that problem? What are the numbers? Who are those young people? We also want to look upstream and really find out what are those reasons and attach data to the reasons why youth are falling into the river, why they're not able to save themselves out of the river. What does that environment look like? So really, assessment is about understanding the whole situation along that river. And so again, when we talk about assessment, we're talking about this process. Here's where we're getting now into the nuts and bolts of doing the work. But we're going to walk through these and just, again, at that level of you identifying, yes, I know this, I'm familiar with this, or no, I'd like some more information about some of these topics. What we're going to talk about, again, depends on our community description. What is this community we're going to be working in? As Carlton said, we need to engage that whole community in doing the work. Then there are three elements we want to look at. What are the needs? So what is the conditions of the youth falling into the river? What are those risk and protective factors? What are the resources? What capacity does our community already have? Then the third element is readiness. Are we ready to, one, do we acknowledge as a community that there is this problem and that there are these conditions upstream? Also, are we ready to implement some of the strategies, individual and environmental, it'll take to do that? We collect that data, we analyze it, and then some of our favorite topics, and we're going to do a poll on this later, is a logic model. And all a logic model is, many of you, I've seen your names as you went through and signed in here, are familiar with it. Logic model is simply a roadmap that allows us to say, these are our community priorities, this is what we're going to be addressing now. If we address these conditions, these upstream conditions, these risk and protective factors, we will see ultimately an impact on these problems and these consequences down the road. And I'm just going to ask my colleagues, Carlton and Tracy, if you want to add anything to this picture of community assessment and logic models.
Dave, I think, this is Tracy, and I think one of the key elements a lot of times in our communities is that we fail to understand the readiness assessment piece. I think that's a dynamic piece, although we know we have to get the data, and we know what resource we have to get the data from. A lot of times when we want to go ahead and really not look at the assessment framework of our communities, I think that's a really key important part to understand in prevention work.
Yep, and I think during this COVID, we're experiencing that a lot. People are focused, obviously, on this pandemic that's impacted us. And so they may not be ready to talk about prevention, but we know there's a clear relationship between the COVID and increase in drug use. So part of our role is in engaging the community, as you're saying, Tracy, is to build that awareness so they can't see the connections between COVID and substance use.
Yeah, David, I was just going to share that that folks shouldn't be off-put. I know sometimes folks get off-put with respect to when they think of logic models and they hear about the tool of a logic model, but a logic model is simply a picture, an understanding of a picture of our understanding of how we're looking at that problem and how we intend to solve that problem. And it's just putting those elements in a way that, in the simplest ways, in the simplest terms, members of our community can engage with this thinking and problem-solving process. And so I actually find the logic model is empowering to communities.
Let's find out, just to be another quick poll, this should be poll number 2. What is your all experience collectively? We've got, 164 people. We'll give this poll about a minute. But have you, and this is a select all that apply, been a member of a community assessment committee? Have you collected quantitative data? Have you collected that qualitative interviews focus group, analyzed data? Have you worked on a logic model? You can describe in the chat box. We just want to get a sense of our collective experience. See somebody saying all of the above. Excellent. So I'm going to stop the poll here just to keep us going. And Kristen, if you could please share the poll. If I can click on it, I might be able to see it. Again, what's interesting is that just looking at the people that were able to respond, that there seems to be equal, again, experience in all aspects of it. And the reason we did this is because we have just a general population of the 164 people here. And this is typical of a community and partners in a community. And so the role of a coalition, the role of a prevention provider is not to do the assessment on its own, not to do this work on its own, but engage community members, engage coalition members in doing this work, because as you can see here from the poll, the people have experience in all aspects of doing a prevention. When you look at a logic model, 40%, that's over 1/4 of you have experience in working with logic models. So this is just wonderful that in a given community, there are people that have this experience. Let's build on that. That's part of our resource assessment, to build off what resources we have in the community. And so, again, just walking through the elements, we start with our community description. And there are 2 key points here. Just going to keep this real straightforward. The first one is we need to define what is, on the left-hand side here, what is that, the geographic or the boundaries, what are the jurisdictions of what we're organizing? Are we a city? Are we a neighborhood? Are we a school district? What is this population? If you're a drug-free community grantee, they want to know what zip codes you're serving, because that defines, one, the population that you're trying to impact. It also identifies what are the jurisdictions. If you're a county, you've got multiple cities, you've got multiple police departments, you may have multiple school districts, health districts, judicial districts, chamber of commerce. If you're a city, if you're a neighborhood, that defines who are the people that we want to bring together from a jurisdictional or from an organizational standpoint. On the right-hand side, when we define our community, we also start, as we mentioned, not about us, without us. We want to engage all aspects of our community. Here's where we can start reaching out to the diverse and cultural populations within our community. So we start to, again, get a sense of, one, what is this community organizing? Who are these people in it? Who do we need to start to engage in doing this work? And I'm going to ask my colleagues to jump in as I move through these, if you have anything to add. So the first part is, once we define our community, then we can start to say, and if we can use the example, take a look at that river, if you will, from our community and say, what are the consequences? How many youth are we seeing swept downstream? What is the drug problem? We're going to walk through these by providing some quick examples of this. And the key points here is we need to understand all of this in order to make those prioritizing decisions about which aspect of the river, if you will, do we want to take on as a community, as a coalition, as an organization. So we need to understand these. And we need to attach data to these, because I guarantee you, if you go before the city council and say, we have the condition that parents are allowing parties in their homes and we need a social host law, I guarantee you someone's going to ask, how do you know that? And so we need to be able to say, this is the data we have. It's quantitative. It's based on our community. And then they're going to say, what's your strategy? And Tracy's going to come back and talk about strategies in just a minute. They're going to say, Okay, how do you know those strategies are going to work to address this problem? That's where this piece comes together. The first part is to collect that data about our community. And just some examples of this. Consequences are, again, what results from use in the community. This is just one example. We wanted to provide a tacit example. And this is looking at ambulance calls for service. It's a generic community, but it's obviously, if we look at this in 2017, we can see that the biggest problem was that alcohol-related calls for services for the ambulance. This is just one piece of data, but it starts to tell us that alcohol is a problem and we're seeing consequences. Consequences are typically what people see in the community, whether it's overdose deaths, whether it's alcohol or drug-related violence in the community. These are what people see. It's arrest data. It's what people see related to the drug use. The second element is the actual drug use itself, and we typically, and fortunately, we have surveys that measure this. In this particular survey, we can look, and again, when we look at it at the both state and our county level, alcohol is the drug of choice here. And so also, here's where we start to use qualitative data to find out not only what is the drugs are young people using, but what aspects of it. If it's alcohol, are teenage boys and teenage girls drinking the same types of alcohol? When we look at prescription drugs, which prescription drugs are being misused? Is it painkillers? Is it the stimulants, the ADHD drugs? When we look at tobacco and nicotine products, how are they using it? Are they vaping it? If youth are vaping, are they vaping marijuana oils? Are they vaping other? So here's where we get to understand, what does that drug use look like? If we're talking about drinking, are they binge drinking? What percentage of those that are drinking are actually binge drinking? So we really understand what is the problem. Then again, walking through these, and we talked about a lot of this in the first session, this is walking upstream. This is just one example of a risk factor or root cause, is we find out that when we walk upstream, that you feel it's very easy to get alcohol. So this is what, 63.6, or almost 2/3 of young people think that they can get access of drugs in the community, and particularly, in this case, alcohol is the one that's most easy to get. We don't want to stop there. We want to find out, okay, where are young people getting it? And this is from just a survey where they're getting it from multiple places. The biggest slice of this pie is they're buying it themselves, which means they're getting it from retailers. They're getting it from these other sources, but here's where we can use data to go from what are the consequences. We're seeing ambulance calls for service. We know young people are drinking. We know it's easy to get. This tells us where they're getting it. That's going down to the detail. We can act on each of these. If they're getting it from stores, if they're getting it from strangers in the community. Once we know, again, the detail of what that risk factor looks like, we call it community conditions or local conditions, then we can act on those. When Tracy's talking about strategies, he's going to be talking about strategies to address these local conditions. Yes.
And David, the previous slide, and we want our viewers to understand, the previous slide and this slide actually shows the uniqueness between getting both qualitative and quantitative data to use to really help us assess what our communities are and where they are. So I just wanted to point that out to our listeners and our viewers as well.
All right, so we need to understand, thank you, what is that? Again, you can only get so much information from a survey, or you can make assumptions. If you see arrests are going up, you're going to make assumptions. Let's talk and find out why that's happening. Or if they're going down, why is that happening? And so we don't want to stop here. We also want to be able to look at what resources do we have in the community. And so, again, we can look at, this is a typical resource assessment, but what do we have to bring to bear? Who are our partners? What services are they providing? What sorts of programs and strategies that can be put in place? I love who's highlighting this, to be able to improve the quality of life and more specifically address those conditions that we've identified. This is from a community resource assessment, just a sample, but basically if we saw that youth were getting alcohol from retailers, we can see law enforcement is already doing compliance checks. We don't need to recreate the wheel. We're already providing information to businesses and training on what are responsible beverage server practices. So we have these in place. We don't need to bring them in. We may need to enhance them. We may need to expand them. But let's already look at what resources we have, what partners are already doing, so we don't have to recreate the wheel. And then the final piece of the assessment of our three elements of the needs, the resource, is the readiness. And readiness, there's a lot of ways of looking at it. It's basically saying, as Tracy mentioned, is our community, there's two aspects of it. One, does the community understand that there is a problem in the first place? If they don't think there's a problem, or if they're in denial about the problem, then they're not going to want to mobilize to address the problem. The second aspect of it is they may think there's a problem, but if they think our strategies are not going to work, they're not going to support those strategies. So we need to build awareness. Addressing readiness is a lot about working with partners, working with segments of the community to raise their awareness about the problem and to raise their awareness that, yes, we have strategies in place, evidence-based strategies that can address the problem. And I love it. Carlton summarizing 4 buckets of community assessment: consequences, problem behavior, risk protective factors, local or community conditions. We also want to look at resources. We also want to look at readiness. And here's just an example of from a survey. Again, if people don't think that how serious is this health topic, and the question was about alcohol misuse in the community. Again, it looks like 75% think it's a major or a moderate problem. If that wasn't the case, if they thought there were other problems, COVID's an example, then we need to raise awareness of, yes, there is a relationship between alcohol use, drug use, and COVID. So we need to raise the awareness of the problem. And Carlton's adding some really good comments. This is a way to engage people, not about us, without us. Let's get input from people. And again, the way we collect the data, and this is one slide about data collection, but basically there are multiple ways. We've talked about quantitative. This is where we do surveys, and archival is another form of quantitative. Let's look at what our partners, our law enforcement, our schools, our health department, let's look at what data they're already collecting. But then let's look at that middle piece. Let's go find out and talk to people about interpreting that data. What do people see? What do young people see? What do parents see in the community? Those are those interviews, those focus groups, those listening sessions. And so there's lots of ways to collect the data. And even under COVID, it's easy to do this. If we were a coalition meeting, it'd be a wonderful coalition meeting with 165 people. I'm just going to ask this one poll here. Which community, and this is select all that apply, which of these conditions, these are all local conditions, and this is just a poll, parents provide alcohol at the prom, or we have relaxed regulation of home delivery and curbside sales of alcohol during COVID. Student athletes share their prescription painkillers. Convenience stores promote and sell marijuana and vaping paraphernalia. Meth is sold in local parks and others. This is just to get a sense. We're doing a quick assessment of the 165 people we have here. And I'm seeing all of the aboves in our community.
Wow.
Yeah, I'm seeing that too. Wow.
Okay. So if we stop the poll and just share it, I see several all of the aboves. The point is, again, there's a range of answers from our community. This is another piece of information that tells us, again, from people, I would want to find out, again, if we were doing this for real, if this was our coalition. Okay, so those that thought the parents are providing, tell us what that looks like. Those that think the students are sharing, tell us what that looks like. So we need to, again, find out that qualitative data, as well as then we're going to go to schools and say, okay, what do you know? What kind of reporting are you getting about student sharing? What are your school resource officers? What are your coaches saying? What are your school nurses? So again, we use that quantitative and qualitative data to be able to start to say, what is this issue in our community? And so the whole point is when we prioritize it, there's a lot of detail here. There are entire college courses on some of this data analysis techniques. The point is, when we did the poll at the beginning where we had everybody show your experience in doing an assessment, there are people in your community that love doing this, that pulling it together. We can also then share the results of our data analysis where we can look at the magnitude. And I'm going to use our example of the river. How many youth are falling down the river? What is the extent of the problem? The severity of the problem. Are we seeing people die from a particular drug use problem? What is the harm we're seeing? trends. Is the problem getting worse, or is the root cause getting worse? Is the risk factor getting worse? Is it getting better? How easy is it to change? If we've had 100 years of history where the parents are celebrating providing alcohol with their children, that's going to take longer to change than maybe retail selling alcohol to minors, where we have good proven strategies. And then are there disparities where certain elements of the population are experiencing the risk factors, the substance use problems worse than others? These are all considerations. And again, each of these would be their own course, or we could do a whole course on this. The point is we have the skills in the communities to be able to start to look at this data. Ultimately, we want to prioritize based by saying, if we're looking at a risk factor, we're looking at a particular problem. One, how important is it? Meaning how severe, how many people are impacted by it? How many people, and then changeable, is there something we can do something about it? All this to say that when we go through and we start to prioritize, that's where we're getting, and Carlton mentioned this and Tracy's mentioned this, we can engage people in these decisions. For instance, I can do one here. I'm just going to do one of these. But in your community, and this is, which is the biggest? And it's in the chat box. If you can go ahead and put in your community, which of these drug use problems for young people is the biggest for youth? So this is just going to tell us your opinions on prioritizing. And just to get a sense, B, alcohol, marijuana, D, tobacco, nicotine. So I'm just looking at what people are putting in the chat box here. And so if we were a coalition, again, of 165 people, I'm seeing a lot of A, Bs, Ds. I'm thinking we could form 3 work groups. You're telling us your prioritization, one addressing each of these, and then develop logic models for those work groups. The whole point is we want to look at the data, understand it, engage our coalition members, our community members in understanding the data to be able to then allows us to, and I'm going to skip this 3, develop a logic model, which is really just a roadmap. And a logic model, and I'm going to take a breath there. Anything that my cohorts or anything in the chat box around that data collection, data analysis, I'm seeing Carlton give me the sign to keep moving. So once we've done that, we've engaged our community. My last poll of this is, love to hear your experience with logic models. The last poll here is A, what's a logic model? B, I love working with logic models. I like working with logic models. I avoid. If you're saying any of these, go ahead and put down why you think you gave your answer. Why do you love working with logic models? Here's the poll.
Many of them already started answering in the chat.
Yeah. Again, so I think logic models are something we all have an opinion about. The point is a lot of people, some people love it, some people don't. Our challenge as coalition members, as providers, is to really make it accessible to people. It's based on data. It's based on our prioritizations. If we can share the poll, please, we can get a sense of where our community of 165 people feels about logic models. Again, I'm seeing some great chats. Great way to, if I can look at the chat, great way to summarize, a great roadmap, a great way for sharing. Again, some people love their logic model. Some they like it because they see it's useful. The point is, if we, as Carlton said, don't mystify it and we make it accessible, it really does provide that roadmap or guideline. And really, all a logic model is, it's a summary of our prioritizations. So in this simple example here, we prioritize underage drinking as our priority problem. Then we're able to say, no, we have 2 risk factors, favorable parental attitudes and availability. We prioritized availability. We've identified 2 local conditions, and we're going to focus on the local condition of retailer selling to minor. We have qualitative and quantitative data to back that up. However, we've engaged our community members in this decision, in this prioritizing. Now we have a roadmap, because now we can start to develop strategies for each of the local conditions. The retailer selling to minors, the restaurant servers, the parents who host, the parents who allow children to drink on weekends. We prioritize, in this case, retailer selling alcohol to minors. It's a very clear problem and changeable problem that we can address in our community. And with that, how would I do? Turn it over to Tracy who's going to say, what do we do once we prioritize a local condition on our roadmap?
Okay, Dave, thanks for that. I think, can you all hear me?
Yes, we can.
All right. Thank you very much for making it present. So now is the time to really review the next phase of the SPF planning process, which is planning. This is sometimes viewed as the part in a good program design or implementation, which wants to be, well, really of us, a lot of times don't like to be focused on this. But we all know it's not about us without us, as Dave would say. So if we fail to plan, we plan to fail. And I think that's the dynamic piece of this. So planning is critical. And since I see us as preventionists, as what I call physicians of our community, this cannot be an option. I mean, when I talk about being a physician of your community, I see it as a critical part in what we are to do. Where are we to focus on? As a physician does with us, he or she takes us through a broad sense, a broad step of all these steps that we have went through. And then when it's time, he or she, as a physician, for me, always says, okay, Tracy, what's the plan? We know what your issue is. We know what your concern is going to be about. We know what your diagnosis is. Now, how are we going to move this forward? And so you can become better at what you need to do. And that's what we're talking about literally here for you all, is that when we talk about planning, strategic planning and the framework, it's important to organizations and coalitions because it's the glue, what I would call, to really see change occur eventually in a more focused manner. It's really about the practical planning process used to enact that change and make things happen. So using a logic model, as previously presented by Dave, is really important. Why? So now that you, one, have identified the risk and protective factors to substance abuse problems within your targeted area. Two, you focused on what's the impact of these factors, including is it evidence-based? Is it evidence-based? Is it comprehensive? And we want to make sure it ensures to be the best fit for our community. So we'll talk more about these in a few minutes. But we also want to talk about the importance that we have to create then that action plan that goes with this, and then ultimately leading to the most important part that you all wait to do as preventionists, and that is implementation. And for those of us who like evaluation, and that's not in my bailiwick, but some of you love evaluation, that's the next thing that they will definitely focus in on as well. So here's a poll. Again, we just want to take a couple minutes with you all and just ask you to, what aspects of planning have you participated in? And you can select all that apply. And we'll give it a minute or less just to get your thoughts. I want to see if you're confirming the logic model within the community, researching evidence-based practices to address community conditions, developing those comprehensive strategies with community partners, maybe some action planning, maybe some engaging the diverse communities in the planning, and maybe it's just all above or other. So, come on, you all, let me see what you're saying. And I know we want to hear from you because it's really important that we get a sense of where you are and what you're trying to impact. And I see some folks that say, go ahead.
Yeah, I was saying it's extraordinary, Kizzy. We're getting all of the above and no experience with any. So we have quite a range. Awesome.
That's good to hear. And see, that just shows that, the planning process is critical and that what areas you have to focus in on to really, really be effective in what you need to do. And that, once again, this is a logic model because it shows, what the misuse. Look at the data that's come out. Yes, awesome how you all have sort of in the polls have really looked at everything, and all above is really important. And so it's important that we know where we need to go, and using this sense of what's going on in our community is really important. Thank you all for your input in the poll. So let's take a look at this particular logic model here. This logic model shows, what our concern is, what our issue is, and that is, as Dave said earlier, underage drinking in our county. But it also identifies what those risk factors are, and for this purpose, as Dave did mention, we're going to focus in on retail availability. but it also shows what those contributing factors are, those local conditions are to this rather. And that's obviously local retail stores will sell alcohol to minors without checking their ID. So we also know that, so when we identify these areas, we can now look at what interventions or approaches could we use in order to make this effective and useful for us. And so this is where we really begin to identify on this next slide the sense of what's really evidence-based and how you move towards that. The intervention we use or should use is one, it addresses the risk and protective factors, but it also looks at evidence-based. What do we mean by evidence-based? As I would say in many of my presentations, you all ask awesome questions. What do we mean? Well, first we know it has been supported by theory. It has been looked at from empirical data. It's been published in a refereed journal like the Journal of Sociology Work or Social Work, the Journal of Psychology Work. And those results are really there, and it's published in those journals as what is an evidence-based model, or evidence-based process, or evidence-based policy. It also incorporates what we call community experience, meaning the intervention has been used within the community with some relevance and with some engagement. And then lastly there, it focuses on that sense of local community practice. And that is really about, in many communities, there are local customs and practices, which really is a result of the effectiveness or has shown to work within evidence within these communities. Many communities that have cultural backgrounds and customs that they use that have been effective have seen to be useful and very forthright in coming in their work. Let's look at, now that we have identified those really important, those really effective evidence, and we know what the evidence-based strategies are.
Tracy, can I just add one thing about the evidence-based?
Sure, Dave.
You cited a range of information about what is evidence-based. Just keep in mind that different funders, different states, different lists of evidence-based strategies have different criteria for that. So you may see some strategies on one list, not on another list, and that's okay. It's our role as prevention specialists, if we can use that term, is to understand, okay, what criteria did they use for this? Why did they use that criteria? What can we learn from this strategy, from this evidence provided about this particular strategy? So just recognize that you may see different criteria for what is evidence-based.
Awesome. Awesome. Great point. Awesome. Great point. Okay, let's go to this. Let me go back. Go back. Be patient with me, folks. I'm getting back here. Thank you, Dave, for that. And so also when looking at and planning, at the planning focus, you know, we heard Dave really talk about how we look at the interventions or the strategies and which are comprehensive in nature, especially within, as was mentioned before, these two critical areas. Individual strategies, that is providing information, enhancing those critical skills, and really focusing on those services and support that goes with that. And then secondly, from a broader sense, from an environmental strategy approach, those strategies that really help modify or the access of issues or concerns, reduce those barriers so they can enhance that or enhance those barriers, change those consequences that are really important, change the physical design of the environment and examples of doing that, as well as modifying any policies. I mean, one great example that I know in some places where they've modified the policy of tobacco, where a county has raised tobacco to purchase tobacco, it would take $10 to $11 per pack, and they've seen a reduction because of that environmental strategy approach. And so that's that's one example, but both of these are an area which will ensure impacting at both the person-centered level, which is the individual strategy, and the population level, which is as well just as important. So let's look at some other examples as well of that. Let's look at some of those examples, you all. Here's a thing. They're looking at community conditions, locally owned retail stores to minors without checking ID. If we're going to use that strategy in our lodging model, here's some examples of that we can look at as preventative. If we're going to provide information, we're going to look at information, maybe giving information to store managers on the consequences of selling to the minor. We also could look at enhancing skills. You know, one way we can do that is that we need to provide training classes to clerks on the liability or selling alcohol to a minor. We might want to look at changing the consequences. Maybe we institute a tiered sanction for non-compliant retailers. Or maybe we want to change the environment. Place all alcohol beverages inside of a cooler or behind the door, just the location of where it's located, from non-alcoholic products. And then, of course, as I said a few minutes ago, we want to modify those policies, maybe look at those local resources to mandate maybe responsible alcohol sales for training, make that an actual mandate to really utilize that concern. If the local condition is locally owned, retail stores that sell to minors without checking IDs, then we can really impact both the individual as well as the environment. Carlton.
Hey, Tracy, if I could just add one more piece to that.
Yes.
As he mentioned, you can do any of these strategies, and coalitions do any of those strategies, but also think about it as if we're using it as a comprehensive set of strategies, if we do all of those strategies, how much more confident would we be that we're going to be actually able to address that local condition? That's the question here. So it's not either or, it's all of them combined.
So they all work synergistically together if we utilize them all collectively. Thank you. So when we find, so if we use those strategies and we identify what worked really well collectively within our community, we find evidence-based options that we really want to focus on. What's the best fit? What program really worked for our community? We have to address some really community, salient risk factors, protective factors, and contributing factors that go with that. We have to find the options that really fit well for our targeted community, which programs, policies, or practices really fit well. We have to consider that fit. And in other words, what does that fit look like? And when considering that, does it target the opportunity for impacting multiple domains? Is it feasible for the community resources? Is it really effective, as we said earlier, about impacting our community? Is it ready to be able to do this piece? And does it add with our strategy? Does it go well with the existing strategies, other strategies that we've identified to really impact this community? And then finally, we have to consider its strength of evidence. I mean, what does the data say, you all? What does it say based upon what it impacting your particular targeted population? Does it in fact have an impact to your population? And does it fit well with the target population that you're trying to serve? And so it's really important to understand, to find the options in terms of what you have, what you want to use, consider the fit for your community, and then consider the strength of the evidence. Then you have the best fit, the strongest fit, and really the strongest and effective type of really evidence-based strategies and interventions that's going to be useful for your targeted population. Here's an example, you all, of taking that strategy and identifying what we want to do and put it into an action plan. Let's look at what it is. So you have the action steps that's here. You provide that point of sale of materials to the retailer. Look who's going to be responsible, and also when we want to have it done. I know this seems mundane and we know about this process, but we don't want to take it for granted. We want to make sure we have an action plan that's really easily useful and followed by anyone who comes into play and wants to use that. What's the resources required? What's any potential barriers that we may come across that we may see? Because that helps us identify and be able to make adjustments when need be. But yet, and finally, I like this piece added, and that was who are the collaborators? What are other folks in our targeted area doing around this piece that we can partner with collaboratively to really make this useful in our community? That's a strong piece because that says to us, you're not doing this alone. You've identified who to bring to the table, who else should be a part of this process. And then finally, from an implementation, then it's time to have fun, y'all. Then it's time to get busy. This is the part we've always been waiting for. When doing so, it's really important when needed to ensure that the evidence-based program use is implemented with fidelity. It's so critical that when we mean by fidelity, that we're implementing those strategies as it was intended to the audience it was intended for. I mean, when I talk about using the medicine that my doctor gave me, I have to use it with fidelity if it's going to work for me. So anytime when we do work in our communities and we implement our evidence-based strategy, we have to make sure that we've implemented with fidelity. We also want to make sure that we've looked at some adaptations because it may not fit particularly targeted for our targeted population. So maybe we have a strategy or any of the strategies that we want to ensure relevance for specific targeted populations to make sure that it really needs to work. Because I've seen some communities where we've had to take some modification, some adaptations to certain evidence-based programs like life skills, like creating lasting family connections, like strengthening families, because we had to adapt it to the population in which we're serving. And then also there's some adjustments that may be needed. Sometimes we have to modify our strategies to really make sure that specific conditions and circumstances are underlined in terms of how we're able to really work and to really impact our community in whole. So, when we look at this, what about fidelity and adaptation? Here's a poll for you, and I know we polled you around, folks, but we want to hear what you got to say and what you think about. And this poll really looks at a best practice curriculum for 12 to 15-year-old calls for 20 sessions to be conducted in a school setting. You only have time, though, you all, for 15 sessions, and will implement in a community setting. What's your recommendation? Let me know your thoughts. What's your recommendation? Do you go A, find another program that has best been tested in a community center? B, find a school that can provide 20 sessions for 12 to 15-year-olds? C, combine sessions to 12 to 15 and adapt for the community center? D, hire a consultant with expertise in the program to lead the modules or other as described. And there's another one that I want to give you, and that's important to know. Of course, we know this one, and that is always talk to the developer. That's important to know. We go back to talking who developed the program. But I want to hear your thoughts on what your options are. Give it a 30 seconds for a review of the polls. Go at it, you all. Any thoughts from my team members? Any thoughts? Any comments?
I would say it's a thick poll, so it takes people time, I think, to read it and then to think. Okay. This is a doozy of a question.
So what are we seeing what kind of results so far are we seeing? Any chats that we're seeing?
And just to go back, this is what Tracy talked about when we talked about fit. Not every evidence-based strategy will fit to how we want to use it. And we want to be fidelity, meaning we want to deliver it as it was evaluated. We can't always do that. That's not
right. Right. So what's our results showing? Awesome. Some people work with developer to make some adaptations. I heard that. Thank you all. Some said combine those sessions. Awesome. Awesome. Thank you for that input because that's a good point. I kind of can go with that. I like that idea of combining sessions to fit the community center. So there's others that you see. We want to thank you. Have a capture audience. Students have a capture audience. Work with developer. There you go. We thank you all. So now we've done strategies, planning. We got the strategies in place. We got the implementation going on now, you all. Now it's time, and I'll turn it over to, I think it's to Dave, I think is next, and talk about evaluation. Dave.
Thank you. I'm just going to start out, and did the slide move to respond in chat? Just want to check. Good. Let's have you all answer. Why do we do evaluation? Why do we do evaluation? And this is going to be the gist of the training on evaluation. And I'll just
turn this back over to you, Dave.
Dave, it's on the evaluation slide right now.
Okay, let me see if I can move it back now.
Yeah, I need to turn it back over to you.
Kristen will do that.
Okay, gotcha.
Okay. So are we seeing the response to that? Okay, great. Thank you. Again, and I'm going to challenge you all with 163 people. We can come up with, my record is 25. Can we come up with more than 25 reasons? Determine effectiveness, to see the impact of what we're doing, to make sure it worked and helped others, to make sure it's working. We need about what we're doing, what we said, are we doing what we said we'd be doing? I love it. To see where we need to make changes to our program, determine if it's working. I think we're up to 18. See what's really working, see what's really happening. Are we meeting our challenges? Are we identifying our objectives and meeting those objectives, confirming program effectiveness? So you all know why we do an evaluation. This is excellent. So you all, we're setting a new record here, sustainability. If we show effectiveness, we can sustain the program and sustain our efforts. So these are all the reasons. We all know why we want to do an evaluation. And so there are just some key points to make here to wrap this up. If you do a good job of assessment, of engaging people in assessment, if you do a good job of planning and picking evidence-based strategies to address specific local conditions, evaluation isn't difficult. And I say that, but it really should not be separate from our other work. It's a separate box on the strategic prevention framework. But if we've done a good job with assessment, capacity, and planning and implementation, assessment is easy. Evaluation is easy. And so basically, evaluation is exactly what you just said. There are two elements of it. One is process. Did we do what we said we were going to do? Were we guided by the evidence-based strategy that told us what we need to do when we developed our action plan? We said we're going to deliver 15 to this audience. Did we deliver 15 to this audience? If we're doing compliance checks, did we said we're going to do 12 compliance checks? Did we do 12 compliance checks? The outcome is, did it change what we wanted to do? If we wanted to build skills through a curriculum, did we do a pre and post test and see that those 12 to 15-year-olds in that curriculum, did they learn the skills and knowledge they needed? Did we see a decrease in, if we're doing compliance checks and responsible beverage server training, did we see a decrease in retailers selling alcohol to minors? So process, did we say what we're going to do? Outcome, did we achieve what we wanted? And then the final piece is impact. This goes back to our logic model. Did all this have the impact that we wanted to have? This is where it comes into sustainability. Here's where we start looking at the impact of the comprehensive strategies. So just to look, this all goes straight back to our logic model. If our local condition was retailers selling alcohol to minors, and our strategies start to increase compliance checks and retailers trainings, processes, did we do the compliance checks? Did we provide the training? Again, if we do a good job planning, we've already done our evaluation. The outcome is, what did that, addressing that local condition, did we see a decrease in retailers selling to minors? Again, we can look at failed compliance checks. Did we see a decrease in youth report that they're getting alcohol from retailers? The overall impact is that bigger picture, goes back to our logic model. We decrease retailers selling alcohol to minors, decreases availability. Ultimately, that'll decrease underage drinking in the community.
Hey, Dave.
Yes.
I was just wanted to also add here that I like the process part of it. Even though I'm not an evaluation per se, I like the process part of the evaluation because it allows me to make some changes and adjustments if I need to along the way. And that to me is more important because that way it keeps me from making the mistake further down the road. So process to me is really a good way of what I call good prevention work.
And thank you, Tracy. And that was not a plan. what Tracy said was critical. She says, I don't like evaluation, but I do like making sure we implemented our programs. Again, we can engage people in the evaluation. If they've been involved in doing the assessment, this is a continuous of what we said all along. If people are engaged in the planning, in the prioritization, in the planning, and the action planning, they will want to be a part of the evaluation to make sure that what we put all this effort into will have the outcomes and impact that we wanted. And so Tracy may not be doing the regression analysis on the survey results. Tracy is going to be helping us to say, hey, we were only able to deliver 14 sessions. How are we going to get that 15th session delivered? So if people are involved in the assessment and planning, they'll want to be involved in the implementation and evaluation, period. And I'm going to turn it over to Carlton that's going to just wrap this up and then turn it over to questions. We've covered a lot of information and haven't taken time for questions, but we want to make sure we do that. So turn the power back over to Carlton.
Fantastic. First and foremost, folks, can you help me thank both Dave and Tracy for two wonderful presentations and for guiding us through the bulk of the conversation today. Go ahead and show your appreciation in the chat if you wouldn't mind, help me go ahead and do that. This has been really, really critical here. One of the things that I really want to emphasize is think about it. We talked to you all about assessment. We talked to you then about planning, and then we ended up the conversation talking about types of evaluation and the importance and the role of evaluation. What all of those have in common is that they're all parts of the way we as preventionists tell our story and tell our story well. Tell our story in a way that engages the broader community in our process. Tell our story in a way that allows for funders to have confidence in investing in us. Tell our story in a way that we're able to convey that prevention is an effective means to settling and solving the issues and challenges of our society. And so it is critically important that we not only understand the importance of the language that we've been using today, but that these are indeed skills that as preventionists we develop so that we can make and draw these connections as you're supporting each other. Fantastic. So I offer, please put in, get rid of the poll, Kristen, if you wouldn't mind. Go ahead and get rid of the poll. Get rid of the poll. What I'd like to do is I'd like to pose a question first and foremost to Dave and Tracy, and all the while, I'm wanting each and every one of you, if you have thoughts and if you have questions or even comments that you'd like for us to consider right now, this is the time for us to really have a conversation and delve a bit deeper in the comment. The question that I have to both Dave and Tracy to kind of start us off is, all three of us have worked with communities all over with these things, and we know that this is really where the speed bumps come in, or where communities often hit potholes in some of the work that they're doing. What would be one of the critical areas that you think that are, I guess, the most prominent kind of mistakes that I think that preventionists or organizations or communities make as it comes to either the assessment or the planning or the evaluation? What are some of the kind of frequent, mistakes or errors that you think that they make? Part of what I will share is that I see many communities devaluating the assessment process. Like, they don't really appreciate the real importance of that being not just a product, but a process that they need to really master, right? They think and they see assessment as, a survey is done in my community, and I know I participated in a survey. But we know, as you explained, assessment is more than that and critical to the effort. Dave, what are your thoughts, if I can come to you first?
Coalitions don't make mistakes. Prevention providers don't make mistakes. I think some of the challenges is, and we've talked about here, is demystifying the process. Mm-hmm. Really, if we just ask people, again, we're doing an assessment. If I go up to someone on the street and ask, what do you think is the biggest problem facing young people today? That's the assessment. So everybody has a role in all aspects of this, and we have a tendency sometimes to make it more complicated or more challenging than it needs to be. There is a role for everybody in this thing that we call the strategic prevention framework.
Wow, excellent point. Excellent point. Tracy.
I think for me, I think assessment definitely you took my answer as one of them. I think that's critical. But then the beef of it is to reduce those turfisms, and that's capacity building. I think a lot of times we tend to, because a lot of times the individual money that comes to our communities sometimes gets in the way of our ability to build capacity. And so some of the challenges, I'll go with Dave's words, is some of the challenges that communities are facing, coalitions are facing, is that inability to really partner with a sense of partnership. Do we have the knowledge? Do we have the relationships? Do we have the trust? And I think so that capacity building piece is knowing where getting people to fit in and how to fit it in. And then the second piece, I see a lot of communities with their challenges around planning. They want to jump quickly to implementation. They don't want all this other stuff. I think I know what already is needed. I don't need to do too much of all the other stuff. I'm ready to jump right in as a coalition, as a prevention provider, and just go right ahead and do the work. I know what's needed.
Excellent point. Excellent point. I simply also share and add that I really love when Dave brought out the three types of evaluation that we believe that communities really ought to think about. First and foremost, that you understand that thinking about your evaluation should happen from the very start of your consideration for what is it that you're planning to do with your community. And as you're thinking about it, thinking about those three different types, not just, your process evaluation, which is kind of how many folks and did we do what we said we would do, but also really putting into and getting some help and support and thinking about how are you going to measure your outcome and how you measure your impact on that. Excellent concept. I'm really hoping that there's some questions for us, Kristen. Have you seen any?
There are some.
Carlton, if I could jump in, I'm looking at Doug Green's question or comment about, if I could, familiar with it, logic thought or local conditions really clicked in when describing it as a behavior on location. That's where my light bulb went off. And that goes back to, and I made a note, Kristen also made a point when you asked what is a summary from before. Kristen said prevention works where the agent and the host and the environment intersect. So that's really where our local conditions are. And when you talk about policy, I can't do a policy around inadequacy. I can do a policy around the behavior of young people sharing their prescription drugs at school, because that's a behavior at a location, and I know it can do it impact it with school policy and other comprehensive strategies. So again, thank you, Doug Green, for reinforcing our local conditions and our strategies are focused on where those agents, the host, and environment come together.
One of the things I also want to add quickly is that it's around that cultural competence piece. A lot of times, and people think that cultural competence means, we just want to get certain ethnic or racial groups involved. But we're talking about young folks. We're talking about seniors. We're talking about using cultural competence and sustainability at each level of the framework. We didn't have a chance to really talk about, but you do it at each level of the framework. And a lot of times, communities have challenges to think if they just do a training on racism or cultural humility, they've passed the test to do cultural competence for the framework. And so, going to that suggestion somebody had from Charity, what suggestion do we have for engaging community members, namely youth and families, in participating in local policy change? I mean, one of the things I found to be very unique and engaging is get those young folks and families involved from the very beginning. And then using words that is not preventionese. So it's not something they don't understand, but using the message and the information so that they can understand why they're doing it, so they can buy into the process, Charity, and then they can move forward and be a part of the process.
I love one of the comments that was made earlier, and Dave, I don't know if you referenced it or not, but I'm just seeing it from our friend Doug Green, and Doug, who shared that what really clicked for him around logic models is really understanding that local condition, describing and explaining that behavior is also a location. And one of the things that is really key about going beyond merely the problem behavior and the risk factor. It's really expressing how does that risk factor demonstrate itself? What is the context and what is the setting in which that issue really shows up? And if you're able to describe that, you really have something that you can then address with a comprehensive set of strategies. Excellent point, Doug. Are there any other questions, Kristen, that you're seeing before we kind of move on to the next piece?
I haven't really seen any, but I'll keep scanning. And other panelists, please feel free to scan the chat for questions. People, get them in. We've only got like 3 minutes.
Hold on. We have.
I'm going to go back to, if I can.
I see, if I can. I see one that says, we have a small coalition and struggle with assessing the local community because much data, oh, come on, sorry. It's in the Q&A, sorry.
What are you trying to do, look for a Q?
Yes, it says because much data is regional or by state and not by city or county. How to spiff with a small group of people. Hard to have work group when there really is only one group.
Oh, got it. So yeah, I think that actually really sends it's a phenomenon that happens in community after community after community that we come into contact with. You get to the two and few, that really taking on the great biggest bit of it. Part of what it is that I would suggest is that you look for what I refer to as those allies, those early adopters, those folks that will join you, that you can begin to build that process of understanding assessment well, and engaging in the community planning process together. You can start off with that small group of folks. And these are folks, usually there are some folks that really like data, really like to engage with kind of figuring out and working through those processes. Start with those and not expect that everybody's going to have the same level of desire to be a part of that aspect of the process.